In 2020, COVID-19 affected almost all countries and more than 50 million people around the world. It has governments operating in a context of radical uncertainty and faced with difficult trade-offs given the health, economic and social challenges it raises. On the health front, many countries are adopting a differentiated territorial approaches. In Nigeria, in spite of the clear danger of COVID-19 infection and spread, Nigeria had to lift lockdown and open up the economy that has suffered greatly and has since slipped into recession. Since then, COVID-19 safety protocols have been introduced and social gatherings, government functions and events have resumed.
The consequences is that some people will have the disease and maybe before they get to the hospital or because of their careless attitude, some people will die.
Now that all caution has been thrown out of the window, people will be more likely to be infected because of closeness of interaction in all of these functions. What would have been the best is that in as much as the lockdown had been eased and there had been relaxation in the measures that were initially put in place, as much as possible, gatherings, because we are hearing and seeing the impact of the second wave in other climes, other parts of the world. These gatherings should also be done with some caution.
Today, Nigeria has recorded over 67,557 confirmed cases of COVID-19 with 1,173 deaths. In spite of the obvious danger, many Nigerians continue to be nonchalant with the COVID-19 safety protocols.
People are careless, people are not so much mindful of the measures that have earlier been put in place, earlier in the year or about the middle part of the year. But they should be. The reason seems to be that, maybe the incidences of COVID-19 has reduced. A lot of people don't even know what the NCDC indices are. At least before now, everybody used to keep stick to their TV sets, radio sets to hear the statistics. But it seems to be when the decline started. But where I may just want to put in that the decline may not be so much that there is reduced incidence as it were. It could just be that there has been reduced testing. We are not doing enough testing to be able to know exactly individuals who are infected or not.
Because we are not abstract thinkers. We don't think about all the news that we hear from abroad. We just look at it that how many people are dying in Nigeria, just 1,170 million people. That's why we are very carefree about it and we just throw caution into the wind.
With many Nigerians behaving as if COVID-19 has been eradicated at public social gatherings and government functions and events, sensitization must continue aggressively. Public officials must also be seen to respect COVID-19 protocol so that Nigerians will attach the importance it deserves to it. With this done, we will begin to see a decline in infection rate and eventual eradication in Nigeria.